9. Hospitals. Introduction to hospital. Jordi Spawn is a 14-year medical student for Barcelona. He has gone to Britain on an elective attachment to Royal Infirmary Edinburgh. Dr. Baron is introducing him to the hospital. The Baron, the Royal Infirmary, is the name of the University Hospital of Edinburgh University. Is General Hospital dealing with anti of passion and illness, action pediatrician. We have a specialty hospital for that in other part of Edinburgh. The hospital for sick children. You can see some of the department in your hospital on the hospital scene. Other, for example, the intensive care unit, ICU, and the surgical independent unit, HDU. Welcome to the Royal Infirmary. South entrance, car park, CED, visitor and staff. The Simpson Center for Reproductive Health, Gynecology Emergency, Maternity Emergency, and Neonatology Emergency, Outpatient Department, other work. Day Surgery Unit, Eye Endoscopy, X-ray Department, Combination System. What does option means? Dr. Barrier outpatient are the people who come to hospital to attend a clinic, or they have tests or treatment at the then return home on the same day. Inpatient stay in the hospital for one or more days. The rooms where they stay are calling ward if a patient treatment requires it only one day, such a simple operation, they can be admitted to the day surgery unit. All patients. Dr. Barrett, the Accident and Emergency Department, E&E, also called casualty, is where patients who are actually ill. When a student survey condition comes for assessment and treatment of patients who have an appointment to see a specialist go to a clinic, one of the outpatient department OPDS, they have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient problem. Inpatients. Dr. Barrow, the inpatient in a hospital admin in on the 3 men away, they may be seen in on the outpatient clinic at admitting forum. There is a lot of demand of the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternative, their GP may arrange admission by telephone because they are actually ill, for example, with suspended myocardial infection, or they are seen in the E&E department where the doctor on duty. Working that time around the admission, this will happen in this case of patient with fractured knee or femur, for example. Large hospital may have an accession unit where patients can be admitted temporarily with their condition assistant. Jordi, assistant, Dr. Barron. Yes, the teachers are more both the condition and what needs to be done to help them after treatment is complete. The patient is discharged back to GP's court. Complete table with words from E, B, and C option. Put a street mark front of the street syllable in each word. The first one has been done for you. Verb nouns. Admin, admission, assess, admissions, discharge, discharged, operate, operation, refer, referration, treatment, treatment. Make word combination using word for each box. Look at C option to help you. Actuality is assignment unit. One only. Referral letter. Waiting list. Which hospital department would be most appropriate for the following patient? Look at E, B, and C option help you. Number 1. A woman in diabetic coma, ECU. 2. A patient who has just had a radical prostatectomy, dye surgery, and endoscopy. 3. A patient who is to have a skin lesion removed, Austin emergency. 4. A man with a foreign body in his eyes, emergency. 5. A woman with a throat abortion, maternity emergency. Complete the statement form and information leaflets for patient. Look at E, D, and C option to help you. When you arrive at the hospital, please tell me reception who will welcome to check our details and direct you to the waiting area. The left your visit, the pen, your checker. You are going to have your may need to have to departments such as X-ray, which could mean going to another alert, or you may be appointment other professional such as physical therapy technician. You may need to receive the clinical staff on the clinical. Want to see you again another appointment with the arrange of you need to be waiting use. The hospital for the more treatment either and impacting for ordinary surgery, you will be told when this is like to happen. If you do not need for the treatment will be assigned to your GP care.